It is my belief that my strong belief that as our environment, our world continues to deteriorate, that our great vegan movement will get stronger and stronger. None of us can survive alone. As social animals, we need to join together, and we need to keep motivating people to eat wisely in order to save our animals, to save our environment, to save ourselves. Tonight's speaker is a physician who was also a vegan. I met him about 10 years ago or maybe 8 years ago when I first started the museum, because I started seeing him at most Chicago vegan events that I was going to. And I noticed him because he is so friendly and so outgoing. And I then discovered that his life work also centers around making veganism even stronger. So I am glad to introduce to you Dr. Ashwani Garg.
Thank you. So she mentioned 1893, right?
That is it. I always say late 1800s, so I don't have to remember that.
Yeah.
But you are right.
Yeah, great. So very interestingly, so 2 years ago, I actually switched from Advocate Health. I left and I joined Advent Health. Advent Health is a company that was founded by Seventh-day Adventists in Hinsdale about 100 years ago or so, roughly. The hospital is very old. And so Seventh-day Adventists treated patients in a different way. So they were ahead of the game. Anyone know who invented peanut butter?
Kellogg?
So actually it was Dr. Kellogg, not Will Kellogg. Will Kellogg founded the company. Mm-hmm. Dr. Kellogg was in charge of the sanitarium in Battle Creek, Michigan. So the reason peanut butter was invented is they wanted to feed them plant-based diet, people healing from disease. And they didn't have a lot of drugs. They didn't have procedures and the techniques we use today. So they promoted fresh air, sunlight, plant-based food, and prayer, and those kind of things. Lifestyle that we call today lifestyle medicine. So Dr. Kellogg invented peanut butter as a means to nourish people. So what's good about peanut butter? High-end protein, easy to digest, high-end fat. So someone who's malnourished could gain weight, for example. So the Adventists started around that time, and a lot of them were what they call vegetarian. Now, there was a huge argument, which is a long story by itself, about vegetarian and vegan. There was no word vegan. So a lot of them said vegetarian means from plants, which doesn't include dairy. And the egg thing came way later. As far as eggs, they weren't considered vegetarian originally. So, so the company Advent Health was founded as in Hinsdale, and other parts of the US, including Battle Creek, Michigan, focused on healing people naturally. Now I'm going to throw out some numbers. So during the flu pandemic of 1920, can anyone guess what percentage of people died in a hospital setting, inpatient hospital?
1%.
Roughly 1 in 3. Roughly 1 in 3 chance you were going to die if you came to a hospital with influenza back then. So the 1% number, 1.3 to be exact, was the number who passed away in an Adventist setting in a sanitarium. So what they founded were sanitariums or places for healing. And the word really is sanatorium, but Dr. Kellogg was a strange character and he wanted to call it sanitarium, as in sanitary, hygienic, and hospitals were not totally sanitary and hygienic originally. Well, I mean, there's a long story of Ignaz Semmelweis, who invented hand washing with the obstetric unit. Sometime you can read about it. But so Advent Health is fully focused on what they call whole health and lifestyle. And sure, today it's more gone towards procedures and medications and all those things. But the company kind of reformed in 2018 and is focused on creating that and they promote that, and they sponsor American College of Lifestyle Medicine. They have a documentary on YouTube, or actually it's viewable freely by anyone. It's called Plantwise Documentary. And you can view it if you go to www.plantwisefilm.com. And they have a lot of teaching resources as well. I use it in teaching PA students. So 45-minute documentary, very easy to share. And they have many other programs. So, so I'm very happy to be part of that group. And so we're going to talk about longevity and disease reversal. So to start longevity, I want to show you that it's not just about the years, but it's not just about adding years to your life, but adding life to your years. Because most people spend the last 10 years of their life in sickness. Who here has known someone who has spent the last 10 years in sickness, right? That maybe they're in an institutional setting, hospice care, in and out of the hospital, back and forth. So that's the key that we want to prevent. And very interestingly, the Loma Linda Adventist studies showed a difference based on what Seventh-day Adventists followed as far as diet. So can anyone guess which group had the best outcomes with respect to weight, cancer, heart disease, and those kind of things? Was it vegetarian, pescatarian, vegan? Which group? Anyone vote for vegetarian? How about vegan? So that is correct. So overall, the health was best in the vegan group. The obesity and body mass index outcome was the best in the vegan group in the Adventist health studies. Those are long-standing studies. Yes?
What's the difference between vegetarian and vegan?
Oh, yes. So vegetarian originally meant vegan, as in no dairy, no eggs, nothing that comes from an animal. But around the mid 1900s or so, I think that's when it came about, the word vegan was the beginning and end of vegetarian, as in that's no animal products, no dairy, no eggs, no gelatin, those kind of things. So the diet goes way back into the 1700s even. And the author of Little Women, what was her?
Alcott.
Alcott, Louisa May Alcott. Yeah, she was vegan. Her family was. Now, very interestingly, in the USA, it was intertwined with Christianity, the veganism. But in India, it goes even back further. Now, anyone remember in the Mediterranean area, which group of people were vegan? Or anyone can name the philosopher who kind of started it. So I'll give you a hint. It is a kind of a triangle with a right angle, right? The theorem that is named after Pythagoras, right? So Pythagoras had this idea long ago about plant-based diet. And one must wonder whether there was maybe some exchange between Buddhism and India and Asia, but that was a very common thing back then. And then there is a Islamic philosopher who was vegan, but he didn't talk much about it. It's just that, in his writings and in some artwork, it is shown that he didn't even drink milk. So can anyone guess that Islamic philosopher? Very famous. So it's actually Islamic, Jalaluddin Rumi, or they call him Mevlana, out of respect. So you can see this idea goes way back, and often it's intertwined with health. There is a difference between vegan and whole food plant-based. Whole food plant-based is what I will talk about, which is avoiding processed food. Now, back then, there was no question. There was no Gardein, there was no French fries that like the way we have now, right? The frying and using oil was very expensive. But today we have to distinguish that what I mean when I say whole food plant-based is vegan, which means no animal products, first of all, and no fried food, generally no oil or very little oil, and a focus on vegetables and fruits as the primary source. And then there might be soy milk and tofu, and generally no vegan cheese, as it is known. There are ways of making whole food plant-based vegan cheese. You can make it with carrot, potato, onion, garlic, and cashews, or using oats, believe it or not. So that can be done. But the studies are based on whole food plant-based eating. And the studies go back to 1950, actually. So very interestingly, around 1950, there was this eccentric doctor at Duke University who focused on rice, fruit, and a little bit of sugar. And in that, there are photos of the participants losing massive amounts of weight, getting rid of heart disease, where there was nothing. They just put someone on morphine and made them comfortable. But getting rid of heart disease, getting rid of hypertension. And there is a disease called diabetic retinopathy, which affects the eyes. The article was published in a recent retina journal. It's called Retina Physician, and it was about healing with the so-called Duke rice diet. The name is Walter Kempner. So that was one of the first studies done on healthy eating. And then afterwards, there are some studies in the 1970s by Nathan Pritikin. Now, very interestingly, Nathan Pritikin was an engineer. To publish in a medical journal as not a doctor was a big deal. So he actually did the work and he gathered some doctors and he published studies on diabetes reversal and heart disease reversal, hypertension reversal back in the 70s. So some of you may know of this doctor named John McDougall, who studied this and he promoted it. He had a TV show back in the 80s. He interviewed some great doctors, including Dr. Heimlich and other great doctors, well known. And then also Dennis Burkitt, Burkitt, and others that were historical, well known for other things, but they agreed with him on the plant-based diet idea. And then as far as the diseases go, first we'll talk about the longevity, but to illustrate, I just wanted to show this brief video. Let's see, I think the sound is off. Let's see.
That's the third button, not the start button, but the 1, 2 after that is the sound. No, it's back the other
Okay.
way, towards the.
Oh, yeah, no, the sound wasn't playing. Yeah, everything's on, but somehow the sound system isn't connected. Oh, now it is, perfect. You got it, you got the magic touch. Let's play it, thank you. And I'll turn it down slightly so it's not so loud. Okay. So what this is a video 1-minute ad from the Heart and Stroke Foundation of Canada. Very powerful. And I like to show it every now and then at presentations. There we go. I'll turn it up a little bit now.
Last 10 years look like. Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment. Grow old with vitality. Disease. It's time to decide. The average Canadian will spend their last 10 years in sickness. Change your future at Make Health Lab.
So this was definitely award-winning video, 1 minute public service announcement of Canada. And the title of it was called Parallels. So you saw the parallel description, right? Now, we can't control all of it. There are things that can happen that are beyond our control. There are some vegans, plant-based, who get cancer. I do see them as patients. Some pass away from heart disease. But the statistics are favorable, as in plant-based diet plus exercise, stress management, avoidance of substances, all of those things, roughly, we think add about 10 years to life. So the USA has one community which enjoys about 10 years longer. Does anyone know where that community might be? Loma Linda, California. Yeah, and the reason for Loma Linda, California, it was one of the early settlements of the Adventists. And by religion, they don't smoke, they don't drink, they go to church, take the Sabbath, which is they take time off every Friday. They look up the sunset time and they take time off from sunset on Friday to sunset on Saturday. So it's all a holistic picture. Yes, they enjoy overall 10 years longer, but amongst the Adventists, there are differences in eating. Most of them eat, let's say, mostly plant-based, healthfully, but the ones who have the greatest longevity are actually pescatarians and vegans. And the reason for pescatarians, if you know anyone who's pescatarian, generally they don't eat fish that often. They follow a healthier diet than vegetarians. And so the life expectancy is longer amongst them as well. So yeah, as far as longevity, the studies are there in the Seventh-day Adventist studies. And then we talked a little bit about Walter Kempner. And then Neil Barnard did these studies on diabetes, showing, so there's the ADA diet, and it was compared to the plant-based diet. The ADA diet would lower A1C about 0.3. The ADA diet about 1.2, or plant-based diet about 1.2. So about at least 3 or 4 times more than the ADA diet, which is supposed to be prescribed. So I've seen a big change in the guidelines now. If you look in the guidelines of American Association of Clinical Endocrinologists and American College of Endocrinology, the guidelines actually say exercise, healthy lifestyle, plant-based diet. It's right in the guidelines. So that has changed based on research that we have now. If any physician is still talking about carb counting for type 2 diabetics, we're talking about type 2, and talking about, let's say, carb counting and ADA diet, they're way behind the times. Perhaps that doctor needs to be educated. Now, the good thing is American College of Lifestyle Medicine has a free course. It's called Lifestyle and Food as Medicine that anyone can take. It's freely available thanks to the White House Conference on Hunger. So the bottom line, this is becoming mainstream. And so as far as diabetes, there's a big benefit. Now, what I see in clinical practice is it's hit or miss and it's dependent upon compliance. But some, let's say with mostly plant-based diet, it could be 85 to 90%. They will reverse it together with exercise, maybe a medication or two, maybe not. But the chances are, what I see in practical experience is more than half chance that they may reverse it. Reversal is defined as normal A1C for 6 months or longer. Now, recently, just to compare the other side, anyone heard of the low carb diet or the keto diet? Or there's a study called the Virta, V-I-R-T-A health study. So Virta Health is a startup funded by venture capital on a keto diet. Now, anyone can go to that website. Recently, Virta published their 5-year trial data. And the 5-year trial data showed that the A1C came down initially very nicely and then scooted up so that after 5 years, it is almost where average A1C started. And the percent in complete remission after 5 years was under 5%. the percent in partial remission was under 15%. So again, if anyone cites low carb, you say, okay, show me the evidence. Let's go over it together. Then you bring up Virta Health 5-year trial data, which is the longest data we have, because usually low carb studies are very, very short term and limited. And so you can compare one to the other. There are still many doctors that I know that still promote low carb. There is one cardiologist I know who still promotes low carb. And what happened with one of the patients is he actually followed the instructions, went low carb. His heart pain got worse. And then what did he do? He went on Dr. Google and he searched how to reverse heart disease. He found Dr. Esselstyn, called Dr. Esselstyn. Dr. Esselstyn called him back and helped him to understand the low-fat plant-based diet. And then his symptoms significantly improved. So speaking of heart disease, back when I was in medical school, we actually studied the Ornish reversal study. Dean Ornish was the first to publish. It was called the Lifestyle Heart Trial. It was published in JAMA. And then there is a documentary on this very old show on PBS called Nova. Anyone remember that show? So around 1992 or 3, I had a chance to watch it, believe it or not. So it was fascinating. But the interesting thing about the Ornish study is it was a package. The biggest criticism people give of Ornish is you didn't separate out stress management. You didn't separate out exercise, plant-based diet. No, the thing is he didn't have that much funding to do a study and separate out all the factors. He had one chance and he showed a benefit. Then he published a longer trial following them longer and showed a continued benefit and even angiographic reversal of heart disease. And these were studied in triplicate, as in 3 different observers who didn't know what groups they were in. And then later on, Esselstyn, Dr. Caldwell Esselstyn of Cleveland Clinic, not a cardiologist, general surgeon, studied heart disease. And there was one physician who was in the trial. The physician had a very long segment of coronary disease. And this segment, let me show you Esselstyn. Okay, 1 second here. The segment was not able to be stented. It was not able to be bypassed because there was too much plaque in that segment. The doctor was miserable and he came to Dr. Esselstyn. So this is published in the Journal of Family Practice. Very interestingly, not a cardiology journal. So this, on the left side of that black and white photo, you can see the original artery, all eaten up and diseased and plaque, too long to stent, because you'd have to put several stents, and too diseased to bypass, because to do a bypass, you have to sew the vein onto the artery, and there's no place to sew it. So this doctor went on a plant-based diet, and the right side is after about 3 years, is that the artery opened up. So there's 2 mechanisms. One is called nitric oxide, which is promoted by eating plant-based diet, especially greens and beetroot and other healthy things. So those open up the microscopic circulation. And then the other factor is some of the plaque does reverse itself, just enough to increase the flow on this. So these were the studies. And on the left side, what you have is what is called nuclear stress test. Has anyone heard of nuclear stress test in cardiology? So very interestingly, it's showing blood flow. And on the graph, normally red is bad, but on this one, on this image, red is good. Red shows blood flow. So what you have is you have a dead spot. You have a dead spot here before treatment. And on the bottom, just 3 weeks after treatment, the donut is almost complete, which is the heart in the cross section. And the reason for the left side being faster than the right side is you see changes in blood flow way before you will see the angiogram change. So the key is to trust the process, to not get so excited about the CAT scan findings and just know the perfusion or the blood flow is increasing right away with nitric oxide with the healthy low-fat plant-based diet. So any questions so far about diabetes, heart disease, or eye disease? Yes.
So is that strictly just on changing to plant-based, no type of medications or anything?
So Dr. Esselstyn did one step beyond Dean Ornish. He wanted to isolate plant-based diet. He did not tell them to exercise. They were on the usual heart medications, yes. But this was diet alone for the most part. The Esselstyn diet is a very strict diet. Has anyone heard of Esselstyn diet? So it is so strict. No oil, absolutely none, no processed food. And I've actually gone on a retreat to Dr. Esselstyn's, one of his homes in Ohio, and it is absolutely delicious. You can have ice cream. It's just made from bananas. That's all.
What's it called?
It's, oh, the ice cream? Nice. Oh, the retreat?
No, the diet.
Oh, the diet, Esselstyn diet, which is, just think of it as a very low-fat version of vegan diet. So there's no nuts either in that diet. And the reason he could have studied nuts, but what he wanted to do is he wanted to isolate it. He had one chance. He didn't have two chances. So he said no nuts. Now, lately, we've found that nuts are beneficial. He just wanted to do low-fat, strict plant-based diet. So we can say that, yes, he has shown this reversal without nuts. And then,
Does he,
yes.
does he have like a lot of patients that just can't stick with the diet that restrictive? That's
There
not-
are, yes,
yeah,
there are
you know?
patients. Does he have patients that can't stick with the diet?
Yeah.
Yes. There are folks who don't stick with it. Yes.
Is that a?
And
what
they do
percentage
poorly.
would you think?
Is it a what?
What percentage would you think would be able to
Oh,
follow through? I
So
mean,
the key is
Yeah.
when they came to him, they were desperate. They were
Okay.
highly motivated.
Okay.
And they had, I believe, roughly about 90% adherence.
Oh, wow.
In my practice, it is much, much, much less. Yes. So it is hard for them to follow. And the biggest barrier are social.
Yeah.
There are saboteurs in their life who don't want to see them healthy, I guess, or they want to have them equally unhealthy as them. Does that make sense?
Mhm.
I know it's very twisted, but I've seen it.
Yeah.
So in fact, this is what inspired me back in roughly 2012. And it wasn't through Forks Over Knives, which is the documentary that reviews this. It was originally through CNN. So it was called CNN Sanjay Gupta, The Last Heart Attack, where he followed Bill Clinton's success. So Bill Clinton was featured in AARP magazine, very nicely done article. Now he's not completely vegan, but he changed his lifestyle. If anyone remembers, he was on the Saturday, he was like parodied on Saturday Night Live, right? Eating at McDonald's, right? So you can find that sketch on YouTube. So I was inspired by CNN, The Last Heart Attack, Sanjay Gupta. And it wasn't that I had anything major. It was minor things, but I was only 40 at the time signing up for life insurance. So then that prompted me to study Dr. McDougall's work, to study Dr. Esselstyn's work, and I dove deeper. And I watched a lot of videos, read some papers, and then I went to Physicians Committee for Responsible Medicine. Has anyone heard of that? Absolutely amazing resource. Dr. Neil Barnard has been doing this since the 1990s. And he was really kind of slandered by the American Medical Association in the beginning. Today, they respect and honor him. And he has passed resolutions at the American Medical Association level. So things have changed 180 degrees now. It's mainstream. So a lot of the mechanism of disease reversal focuses on anti-inflammation. Anti-inflammation because along with all the plants, you get phytonutrients and antioxidants. Roughly 80% of Americans don't reach the bare minimum for fruits and vegetables. And when I interview people, it is shocking that many Americans don't have any, or like, one serving, and it's supposed to be 5. Now in Australia, the guideline is 7. 5 servings of vegetables, 2 servings of fruits. And for an anti-inflammatory diet, that would qualify. Yes.
So I know it helps a lot, like with the heart and that. I have Hashimoto's.
Oh, yes.
How does it help with thyroid?
So there is two parts to Hashimoto's hypothyroidism. Very good question. Thank you. How does it help with the Hashimoto? One part is the actual thyroid level, which can only be helped by thyroid hormone. The nice thing about thyroid hormone is when you buy it, it's identical to human thyroid hormone. It's synthetic, it's created in the lab, and it restores the thyroid levels. Now, there's another part of Hashimoto's, which is the chronic autoimmune disease and inflammation. And for that part, it can help. As far as the weight issue, the joint pain, the fatigue, those kind of things can be helped, but it has to be packaged together with all the other aspects of lifestyle, including fitness, which is weight training, cardio, and high intensity cardio is even better. Stress management, sleep, avoidance of risky substances, those kind of things. So it has to come as a package deal. But oftentimes people start with the plant-based diet and they adopt the other behaviors along with it. And you can see that in the Advent Health Plantwise documentary, how like this medical resident was suffering from fatigue. She couldn't walk up the stairs. She was only, I believe, in her 20s. And she adopted all kinds of healthy behaviors, started walking 5 miles. So the autoimmune disease is a great subject. There are studies on it now. There are 2 journals where you can read it. So one is International Journal, Disease Reversal and Prevention. The nice thing about this is it is free with registration. A lot of medical journals you cannot download. This one is free with registration, and it has a version that is readable by anyone without medical training. The other one is called American Journal of Lifestyle Medicine, AJLM. So this journal is available. Let's say if you go to a good librarian, they can find what you're looking for and get it for you. Or if you go to a university library, wherever you went there, the university library can help you. Tell them you're an alumnus. You show them the alumni card, they will help you. Or you call them up. Oftentimes they will fax or email it to you. And then now, today, the idea is that you publish in mainstream journals. The latest article, which is amazing. So Dean Ornish did the study on heart disease. Next, he went to cancer. What he showed is prostate cancer reversed. As far as these were people with mild prostate cancer, they were in the watchful waiting group. So prostate cancer is all different severities. They didn't have metastasis. They didn't have surgical candidacy. They were in the watchful waiting group because prostate cancer in the mild stages can be watched. So these people showed in the study that they were able to reduce the prostate cancer severity and slightly reduce the size of the prostate cancer with plant-based diet together with exercise, stress management, and yoga was part of it too. So that was the Ornish study on cancer. And then the latest one is the Ornish study on Alzheimer's disease reversal. Has anyone seen CNN documentary called The Last Alzheimer's Patient? That is just an amazing documentary. And what I'll do is I will just show the first couple minutes of it just to give you a preview. But these are people 85 plus, a lot of them, 85 plus, with what's called MCI or mild cognitive impairment, which means early stages of Alzheimer's. And this was conducted in 2020, unfortunately. And so the study was greatly limited, but even with the limitations he had, they did it by Zoom. They did the intervention by Zoom, including plant-based diet, stress management, yoga, meditation, those kind of things. So you have to search for, is Dr. Sanjay Gupta, last Alzheimer's patient. That's it. Okay. And then there is one video somebody uploaded. I will find it. Let's see. There it is. Okay, I'm just going to show the first few minutes of this just to give you a preview.
Report shows Alzheimer's disease is a growing problem. The number of patients is expected to double by the year 2050.
Alzheimer's affects 55 million people globally.
2/3 of those living with Alzheimer's are women. Alzheimer's and other types of dementia will cost the United States about $345 billion this year.
Alzheimer's disease. For far too long, there's been too little good news.
Results from a study of an experimental treatment shows that it failed.
Clinical trials showed it didn't significantly improve brain function and memory.
99-point-something% of Alzheimer's drugs fail.
Why is it so hard to find an effective treatment for Alzheimer's?
But over the last 5 years, I've been investigating breakthroughs, and now, finally, a bit of hope.
This is an absolutely transformational moment.
Nowadays, we have multiple FDA-approved drugs. Our genes are a predisposition. Our genes are not our fate. 4 in every 10 cases of dementia may be preventable.
We must be able to slow or stop this disease now.
Okay, that's what I'll show. So Dean Ornish was on there, and the amazing thing is they were able to show reversal. Now, what they did, again, the package deal of plant-based diet with lifestyle, together with about 5 or 6 supplements, and they're actually listed. And what I do is I take the journal article and I print it out. Okay, so, and it's publicly available here. Okay, this is it. Okay, so the nice thing is you can go to the full article, download the PDF, and it gives all the details of the trial. So if you know anyone that has family member, let's say with mild Alzheimer's, this is what to give. If you have any relatives that have those senior moments and forgetfulness, they need to know there is hope. As opposed to the drugs for Alzheimer's that cost over $30,000 and can cause hemorrhage in the brain and other problems, they're not effective. But everyone asks for them. Whenever someone comes to me and asks for them, I give them this. And our job is to give people hope. So we talked a little bit about cancer. Cancer, okay. So if I'm going to give a rough estimate of the reversibility, or let's say the preventive benefit of plant-based diet together with the other lifestyle changes, for cancer, it ends up being about 1 in 3. 2/3 of cancers are so many other factors, including genes, environment. Just think how much we're surrounded by pollutants every day, the air we breathe, the water, and the plastic, the chemicals. So cancer, 1 out of 3 can be prevented, roughly up to 40%. Heart disease, we think 3 out of 4 can be prevented, which is much better because the changes are rapid. And then autoimmune disease, it's probably about maybe 40% or so because autoimmune disease has so many factors. Mental health is a big factor in this. What questions so far do you have? And then, you know what, I will bring up the online, let's see, chat. Mm-hmm.
I have a question.
Yes.
For the plant-based ones, like what nutrients do most people usually lack when they stick to it, like iron or something?
Oh, the nutrients lacking you're asking about with
Yeah.
plant-based diet. The most common, number 1, B12. And then as far as iron goes, if it's a healthy, balanced diet, there's no problem with iron. If it's a lot of processed food, it will be iron deficient.
So do you recommend taking then a B12 supplement?
B12, 100%. So it's much easier than you think. So you can go and buy dissolving B12 or a spray B12. The spray B12, even 2 to 3 times a week is more than enough.
Can
Yes.
you just take a B complex that has B12?
So B complex often doesn't contain enough. That's the hard part. So it depends which B complex, how much B12. Yeah, good question. Yes, Kate.
I didn't know that McDougal had a TV show. Do you happen to know the name of it?
Oh, yeah, I will show you. Okay. This is so interesting. Let me just do it. So the nice thing about YouTube is you can view all the videos on there. He interviewed some great people. It's worth Dr. McDougall. I'll just show this example. Dennis Burkitt. If anyone's heard of Burkitt's lymphoma, absolute legend of a doctor, the late Dr. Burkitt. So I'll just show a little snippet of it.
Metformin and notice a sudden loss.
Okay, let's forward a little bit.
Or to give it up and take a medicine, and I have never ever for one moment forget that. I was young.
Yeah.
But over the last 20 years, just over, because I switched entirely from trying to cure disease for 100% into trying to prevent disease.
So just ask any medical professional you know who is Dennis Burkitt. They will immediately recognize the disease called Burkitt's lymphoma, which he studied. So the great doctors, and another great doctor that people may not know about is Dr. Spock. Anyone remember Dr. Spock's book on child rearing? The original version of his book recommended plant-based diet and no milk. They took it out in the later versions when he passed away, of course. But Dr. Spock, in his later years, was plant-based. Guess who interviewed Dr. Spock? Dr. McDougall. It's on there. If you think of any historical great people, Dr. McDougall has probably interviewed them. The late Dr. McDougall, I mean. Yeah, he passed away, but his legacy lives on. So, and then just to give you an idea about nutrients, this is such an important topic that you brought up about nutrients. So there's a book called China Study, and there's one chart in that book, in the China Study, that shows the nutrients in a plant-based diet versus regular diet. There it is, okay. So let's see, I will kind of show this enlarged. Okay, so do you see this chart about nutrients? So the left side is plant-based food, which are equal parts of tomatoes, spinach, lima beans, peas, and potatoes. The right side, equal parts of beef, pork, chicken, and whole milk. Just to give you an idea, animal foods versus plant foods. So if you go to the bottom, what's the usual calcium that we are told to take? About that much. This is only in 500 calories worth of food, 545 calories in plant-based food. Now, even with the dairy and animal products, half the amount of calcium in 500 calories. And then the other nutrient of concern is magnesium. How many people take magnesium for prevention of headache, for digestive regularity, for various other things? So as far as that magnesium, once I came home, I have migraine occasionally, so I came home, made a bowl, well, my wife had made a bowl of lentil soup, I poured it in, and I ate all of it because I didn't feel like eating, and the migraine went away. There is so much magnesium in lentils, you wouldn't believe. I just ate 16 ounces at once because I didn't feel like eating anything else. It's comfort food. So very interestingly, magnesium is much more in plant-based foods. Iron is much more, although the availability of the iron is lower, but there's so much more in the plant-based foods, interestingly. Vitamin E is available in plant-based foods, and the nice thing about vitamin E in plant-based foods, it comes in its natural form with many different types. Vitamin C, a nutrient of concern, plant-based foods again. Do you remember the disease scurvy, right? That sailors would get because they wouldn't have, that's why they ate limes and they call them limeys, right? The sailors. And then fiber is not found in animal-based foods at all. For some reason today, a lot of people have this false idea that only animal-based foods is a good idea, but many of them have issues and problems. And then beta carotene, you see how much more? 29,000 versus 17 micrograms. And then protein ends up about equal between the two groups. Many people who eat whole food plant-based get more than enough protein in their food because protein, is it found in fruits? Yes or no?
No.
It is found in fruits, just not a lot, but yes, it's in fruits. It's in vegetables, it's in beans, and it's in grains. It's even in pasta. Next time you make spaghetti, I want you to take that box out and look at the protein content. You would be surprised. In regular white spaghetti, there is protein, macaroni. Very interesting because it's made from wheat. There's gluten. Gluten is the protein component of wheat. So it's in everything. You just have to combine things well to get enough protein. But the typical plant-based person, and this is just simple food, this is nothing fancy. Even potatoes have protein, believe it or not. So everything has it, you just have to eat enough. So if we eat 1,800 calories a day of plant-based foods, you will get all the amino acids. Dr. McDougall has a newsletter article from over 24 years ago or so where he broke down all the amino acids and showed you can get it even from eating simple plant-based foods. You don't have to do protein combining. That's a myth, actually. And then the fat content is much lower in plant-based foods. So do you see that plant-based foods are complete? The only one thing, B12, is not found in plant-based foods. And B12 is not even found in the animals themselves. It's the dirt and everything they eat. And today I see B12 deficiency in both plant eaters and animal eaters, but I do see it less in plant eaters. Why? A lot of the plant-based foods we eat are fortified with B12 because they know we need it. On the other hand, a lot of animal-based foods are not fortified with vitamin B12. So oftentimes the vegan will have adequate B12 because they are intentional about it. Or they love nutritional yeast, which is fortified with B12. So what other questions? Yeah, we'll
So,
take questions.
yeah, so that's what's all in the food, I get that, but then how do you know like how your own body is absorbing?
Oh yeah,
what it
so
needs?
yeah.
And then when the doctor does your blood tests every year, do you find out, like, I know you find out how much calcium and all that stuff, but do you find out about all those?
So
other-
okay, how do you find out if you're absorbing and
Yeah.
how do you find out your nutrient quantity? The calcium in the blood test does not reflect your whole body calcium
Oh,
because calcium and magnesium are often stored in the bones. And the blood level may not truly reflect how much total calcium there is. So it's very hard to detect. The only vitamins that can be detected easily, vitamin B12, vitamin D can be tested, although almost everyone has insufficient vitamin D. To get enough vitamin D, you have to live in California, take your shirt off, ride your bike all day. No one does that. So, or wear a bikini, go to the beach, spend your time at the beach in California or Florida. But no one around here has enough vitamin D unless they're taking it. So vitamin D, generally, it's not recommended to test. It's just recommended to take it. And, reasonable amount is about 1,000 units of vitamin D per day, or I say 5,000 per week generally. We're just talking about rough ideas. And then as far as the other nutrients, if you're taking so much, you don't have to generally worry about absorption. The only case we have to worry is digestive disease. Then you do have to worry, and then you might have to supplement some others. But generally speaking, everything is adequate if you consume a balanced, healthy diet. So as far as a balanced, healthy diet, has anyone heard of the USDA MyPlate? So the USDA MyPlate has been slightly updated in the latest guidelines. And they recommend dairy because dairy is a big deal in the US. We have to sell it somehow, right? But the latest guideline for this now says the dairy can be soy. So this guideline is very important for children. I know some may not care about what the government says, but it's important because as an American, you have the right to have USDA compliant foods in schools. And there is a new law in Illinois that if it's requested ahead of time, they have to give plant-based foods to your child. Now, since it's new, the implementation is variable. But it is on the books. It is a law, and it's on the Illinois government website. And even plant-based milk, the unfortunate thing is you have to have a doctor's note as of now. It's just how it is. It's the best we can do right now. But the USDA MyPlate actually is inspired by Physicians Committee. So PCRM power plate is down here. Well, let's see, PCRM power plate. Okay. So it is there if you just search for PCRM power plate, and it is just like my plate with a little bit of rearranging. They submitted it to USDA. USDA didn't give them any credit for this. But this is the healthy diet. It doesn't have to be complicated. There's no pyramid. There's no complication. Really, this is it. And as far as published guidelines, can I ask you yes or no? Does the Academy of Nutrition and Dietetics of the USA endorse or not endorse plant-based diet? Not, guess what? They fully endorse it. Yes, so it's on the Academy of Nutrition and Dietetics website. They have an official published statement on vegetarian and vegan diets saying that they're nutritionally adequate. And the original statement from 12 years ago said all ages and stages. The latest one is a work in progress. So there's a dietitian named Nancy Guest in Canada. She is one of the lead authors of the guidelines. So what they did was they updated all the research today and they published the adult version of the guidelines. The child version is coming for children and pregnancy. They just wanted to do more research on it. But the Academy of Nutrition and Dietetics officially endorses plant-based diets for all. Well, as an option, of course. Yes.
I know my doctor, because I have Hashimoto's, that have also talked about the Mediterranean diet. And also, the other question I was gonna ask, how does plant-based help with, I don't know if I have this, but what they call leaky gut?
Leaky gut syndrome. So the anti-inflammatory, so how does plant-based diet help leaky gut syndrome? The anti-inflammatory benefits and the fiber helps feed the good bacteria, the microbiome. So very interestingly, in the Dean Ornish Alzheimer's study, he showed that the microbiome improved in those patients following the plant-based diet.
So is that just telling you you're not getting good bacteria?
So the good fiber that the
right,
bacteria
okay.
feed on, that improves the bacteria. When you take a probiotic, you're just taking a drop in the bucket of what the microbiome is. If you added up the microbiome, it would weigh as much as your liver would weigh in the whole body. It is a lot of bacteria, and just taking a little capsule is not much. What your idea is to feed the bacteria with healthy, fibrous, plant-based foods. And that's what creates what they call short-chain fatty acids. And butyrate is made not by butter, but it's made by plant-based food that feed the bacteria that make the butyrate. So just know Academy of Nutrition and Dietetics has an official section on vegetarian and plant-based diets, and they endorse it. It's right on there. Any dietitian can access it. Now, the interesting thing about the Academy of Nutrition and Dietetics, it was originally available only to dietitians. Now a non-dietitian healthcare professional can join and have access to all of their resources and go to their meetings. So they have actually recipes. So here's one, building muscle on a vegetarian diet. Look what's pictured there, right? Soy foods. So I think soy foods are definitely at the top of plant-based foods, but it's not necessary. If someone's allergic to soy, there are many options. So if there's not tofu, someone can make chickpea tofu. And there's pumpkin seed tofu. There's a lot of versions of it. So what other questions?
We have a question in the chat.
Yes.
Somebody said that after blood work, I've been told to take iron supplement and increase red meat.
That's one way to increase iron, but is it healthy for the remainder of the body to eat red meat and take iron supplements? Yes, it will help iron, but what harm will red meat cause? It's a carcinogen, and it promotes heart disease and it promotes diabetes. That's the latest research on red meat, right? So doctors are trained to look at one thing at a time. This may have come from a blood disease specialist. What do they treat? Blood disease. They don't prevent heart disease. They don't prevent diabetes. So I think this example is why it is so good to find someone who is well versed in lifestyle and a dietitian, perhaps, who is well versed in plant-based diet. There is one in the Chicago area who does consultations by Zoom, who is absolutely an expert, certified in lifestyle medicine. And just to give you an idea, her name is Deepa, and her practice is called DuPage Dietitians. She is available for consultations about plant-based diets. But the thing is, yes, she does her practice, but she also makes available lots of free content on her YouTube page, and her handle is Nutritionist Deepa. So, and lots of ideas for cooking oil-free. She also has support groups, which she runs monthly through a nonprofit I work with called the Salient Lifestyle Center. In fact, they're doing it right as we speak right now. So it's a Zoom community free for anyone who wants to join it. So this is Nutritionist Deepa, and lots of free content is there. And lots of information is there. So that's the nice thing about plant-based professionals. Many of them make available their expertise and content for free of charge because we want to teach.
The iron levels in the blood without red meat.
Oh, without red meat? Yes, plant-based foods, vegetables. So we showed in that chart, remember, that iron levels are adequate with simple foods. And this was lima beans, potatoes, nothing fancy. Absolutely not. Spinach. A lot of plant-based foods will contain the iron. The key with the iron, there's two reasons why people lack iron. One is too much loss. So it's important to go after why. In one patient, I found he had stage 4 colon cancer. That was a reason for iron loss. Another reason for is menstrual bleeding, abnormal with fibroid and other conditions. One condition I've seen is urinary bleeding. It was a little bit here and there, and then there was anemia. So when the intake doesn't match, then there's malabsorption. Some people don't absorb it properly, and gut disease can cause malabsorption. So the key is to chase down the source rather than just say, oh, it's your diet. You know, yes, there are things someone can do, but sometimes supplements are absolutely needed in iron deficiency. It is a complicated issue. Then there are all kinds of other reasons for anemia too, that the medical reasons should be chased down before just dismissing and saying it's diet. Any other questions so far? Yes.
Do you have any comment from Dr. Stephen Gundry and his talk about lectins?
Oh, yeah.
So many foods he eats on. My husband won't eat so many things because it's gundams that are wrong. Do you believe that?
So if you eat raw beans, you will have lectins that will make you sick.
But if you
If
soak
you eat-
them and then cook them, they're
Right.
fine, right?
The lectin content goes down, and some degree of lectins are absolutely beneficial for prevention of cancer. So the other thing to know is, why is the doctor saying what he's saying? Is there an ulterior motive? And you can find out by going to Dr. Gundry's website, because look at the supplements. Lectin Shield, right? Lectin Shield. So let's just go. I just want to show you so you know. Yeah, so let's see. I know there's a section where he sells, maybe it's here. Let's see. Oh, it's YouTube. Oh, here it is. I click there, and guess what supplements there are? We'll click on shop, triple biotic gut health blend, unlock member discounts, and they are super expensive. It is shocking. So you want to look at ulterior motives, and let's say, you know, let's say I'm suspicious. I don't want to accuse him outright, but look at this: Total Restore Gut Guardian, Prebio Thrive, Omni Slim, and then you have liver support, polyphenols. Where are polyphenols? They're in your grocery store. Yes.
I've noticed that Dr. Joel Furman is also constantly selling stuff.
Right,
You
he
have
is.
anything on that?
He is, however, Dr. Joel Furman has also made available a lot of PBS programming and a lot of content absolutely free of charge. I've met him personally. He never promotes his supplements in public like that. He sells them because he wants to make them available, but he doesn't push them. There's a difference, selling and pushing. So with Dr. Gundry, the pop-up ads are outrageous. They always just pop up on you when you least expect them. But yeah, Lectin Shield is on there. Let's see, I can just look for it. Here we go, lectin-free food, bestsellers.
But is it lectin something you need?
Yes, it is. Well, it is something beneficial. So the key is soaking and cooking. But the way people promote this is they say, well, there's lectins in plant food. Well, yes, raw plant food and uncooked plant food will have lectins. If you eat soybeans raw, here it is, lectin shield, right there. Do you see that? So why would someone say, oh, lectins are horrible for you, buy my lectin shield? Isn't that a little bit strange, right? So I just want you to be critical.
Who was the doctor that she said, Joe?
Joel Furman. Joel Furman is this doctor, drfurman.com. There's tons of YouTube videos. There's lots of content available, PBS videos. This is Joel Furman. And lots of free content is there. And he doesn't push the supplements. He just makes them available in case you want them. The DHA EPA has undergone some controversy lately. And I have to say the majority of professionals in the plant-based world do not recommend DHA EPA, but he still does. And he has some reasons for it. So, but he doesn't say buy my DHA EPA. He said maybe you want to take it. In his studies, he has used DHA EPA. But let's just say this is minutia. You want to look at the big picture, which is the anti-inflammatory diet that he promotes. He promotes the diet first.
So I have another question, like, this would be kind of like holistic too, right? Why don't insurances cover?
Insurances cover what?
Like going to a doctor with holistics or?
So insurance covers lifestyle medicine. I work for Advent Health. We accept Medicare, Medicaid, HMOs, major insurances. I'm available. Yet very, very few people will consult me for lifestyle. Very, very few. And very, very few will listen when I talk about this because they're just used to taking medications. So the latest and greatest medications are the GLP-1 drugs, Mounjaro, Ozempic. I dole it out every single day. And they do work. But this is the key. They work in that they make people eat less of what they're already eating. So I try to shift them away. And so let's say if you have any family members that you just want to get them on the right path and they're resistant to the V word, the best thing to recommend, fullplateliving.org, which just focuses on helping people be 75%. And they don't even say the V word. So this is a free program available to all. And now there's a full lifestyle program available through them as well, with YouTube and Facebook and resources and everything. So they promote plant food as 75%. They say 25%. If you want to make it plant food, that's great. If you don't, that's up to you. We're not telling you to eat it. We're not telling you not to eat it. Agnostic that way, yes.
Oh, I'm ready for a new question, but
Oh, yes.
I don't want to interrupt you.
Oh, no,
Sorry.
that's good, yes.
I have two questions. Could you talk a little bit more about the omega? Because I am vegan, and I've listened to a lot, and they say we do need that. So I've been taking the supplement, and omega like DHA.
So the DHA, all I can say is there is a little bit of controversy, and there's fights that break out on YouTube all the time over it. Dr. Esselstyn, Dr. Barnard, generally they don't promote omega-3 as DHA. They promote omega-3 as ALA, which is the precursor. And the magic way to help it convert in the brain is turmeric. Now in the Alzheimer's study of Ornish, guess what was part of the regimen? DHA, because these were people with diseases who may not have good absorption. but the studies have not been done so rigorously, and the benefits are a little bit, if any, of that.
And
Yes.
then the second question.
Yes.
If you were gonna recommend an oil to use, like I know everybody says it, what would you
Right.
recommend is the best oil to cook with or like to put in your salmon?
Let's say the evidence is there for extra virgin olive oil. So we have the Predimed studies. Now, very interestingly, someone mentioned Mediterranean diet, right? So what is Mediterranean diet? It's actually this full plate living. It's 75% plant-based generally. If you go to Greece or Italy or Spain, it's mostly plant-based with a little bit of animal food, right? Is that healthy? Yes. Now, did you know that the Mediterranean diet study that was done in Spain was further studied for what aspects of Mediterranean diet were helpful? Can anyone guess what aspects were helpful of the, was it wine? What was it? Vegetables, fruits, grains, and beans. Those were the elements that were helpful. And this one researcher, Dan Buettner, published a book called Blue Zones, where he kind of gathered the longest lived people in the world and he found what were the common aspects. There were a lot of social aspects, community aspects, but generally planned forward diets and beans were the commonalities amongst Okinawans, Greeks in this one island, Italy. Now, what's interesting is one other factor was physical activity. So the people in the islands that had the biggest slope. Has anyone been to San Francisco, for example? The kind of slope that you go up just to get into the city from the pier is huge, right? So that's why you take the cable car up. So that kind of slope was found in the longest lived people amongst the islands. So what other questions? Yes?
I always hear different things about soy milk. Like
Oh,
soy
yeah.
milk is good for you, soy milk
Right.
is not good for you.
Right.
Where do you land on that?
So there's no controversy anymore.
Yeah, okay.
So I want you one day to go to ChatGPT. Anyone have ChatGPT? So AI is very good at compiling the information and just search, is soy milk bad? Does soy milk cause cancer? What it does, or you're doing it now, that's great. So I want you to do it now. So it pulls from the latest research and soy milk is favorable.
Okay.
Soy milk prevents cancer. Soy milk has even been shown in the women with BRCA gene, which is a breast cancer gene, to reduce breast cancer. And the reason is the false idea before was based on animal studies where they would give massive amounts, right? Which is not what humans do. But in humans, you can study soy milk from the Japanese and Okinawans, and the more soy, the better. And people don't consume 2 gallons a day.
Right.
Right?
So soy
Yes.
is better than like an animal milk. That makes sense.
Absolutely better because the hormonal aspect. Now, the research is not so robust, but there's some suggestion that soy is superior. Now, if you look at a bottle of soy milk and some milk, you'll see the protein content is roughly equal. The soy milk has ALA where the milk has saturated fat. ALA is an omega-3. So there's also flax milk and there's other milks, but soy has the highest protein as well as the peas milk. My kids laugh when I call it pea milk. Yes, which is Ripple Foods, for example. Yes, what did you find? Can you tell me?
Well, it says it's good, but it actually, when you use ChatGPT, it keeps access about you, and I have gone to it about Hashimoto's. So it is telling me for me to use it in moderation.
In moderation, which means 2 servings a day is moderation. We're
But it
not saying
does
2
say
liters a day.
Soy milk is generally considered a healthy option for most people, but
Yeah.
whether it's bad for you depends on your health conditions.
Right.
And how much you consume.
So you brought up a very good point about goitrogens. And there's some thinking that broccoli and soy milk are goitrogenic in people with Hashimoto's and hypothyroidism. The interesting thing is when you study it a little bit further and dive into it, you'll see in those people with iodine deficiency, it's goitrogenic, but not in people with adequate iodine. So that's another follow-up question for ChatGPT. What if I have adequate levels of iodine? So iodine, speaking of, that is another nutrient of concern in people eating plant-based. My kids get it through seaweed. So sea vegetables are a source of iodine.
I've seen that at stores a lot, especially at Costco, and what is so good about it?
Oh, it's because it contains iodine. It's a sea vegetable. Very healthy, but you don't need a lot. Literally a couple times a month is enough. So people who don't consume iodine, there are kelp tablets, there's kelp flakes sprinkling on your food. There's dulse, people use it in cooking beans, for example. There's lots of ways to get iodine that way. And in fact, I have noticed in these kids that were eating way too much, they were eating like huge Costco pack of seaweed, 1 or 2 a day. I detected toxic levels of iodine. So they toned it down a little bit. Yeah, and this was massive quantity. So if you go to the Korean store and buy seaweed, you'll see the serving is much smaller than the Costco size.
Are the medications that sometimes interfere with the iodine?
With iodine?
Yeah.
Yeah, there can be, yes, but those aren't common medications. Amongst the common ones, they are not. But it's a good question to ask. There are lots of drug-vitamin interactions, and it's good to ask, hey, how will this affect my thyroid level? For example, there are drugs that affect it. Yeah.
There's questions in the.
Okay, great. I will just bring it up. Okay. Let me just open it up. Okay, here we go. This is great. Okay, these are good questions. My daughter, who is 21, has been a vegetarian since middle school. Part of it is the animal aspect, part of it is staying healthy. She still eats eggs. And eggs are one thing difficult to give up because people aren't used to cooking other foods. So one food, for example, that's a healthy alternative to an omelet is savory oatmeal, which Dr. Usselson loves. So that is oatmeal, steel cut or rolled oats, made with onions, mushrooms, spinach, the same things you'd put in an omelet, and tomato. It's worth a try. So if you've never tried savory oats, it is such a treat and it's very healthy. And then there's, of course, the just egg kind of thing. The only thing, they contain oil and the texture is a little strange. But my wife loves the pre-frozen patties of just egg. She'll make a sandwich in the morning. They're not so bad. So the key is to find those things. But once you study the process of egg production, you'll see that maybe it's not so favorable as far as the animal rights aspect. And I think that aspect is important to study as well, because animal rights ties in with human health. The biggest thing today, can anyone guess why so many hens are killed? Why what pandemic is going amongst chickens and birds? Bird flu, yeah. If you look at the numbers, it's extremely shocking. And if you trace it back, it's the filthy conditions in which they are raised. There was a show on Netflix in 2019, at the end of 2019, called Pandemic. It's a series. That show showed a chicken farm, and it predicted that we would have a massive flu outbreak amongst hens first, and then it could transfer to humans. Everyone's just holding their breath and waiting and seeing if it might transfer. So far, we are good. So far, it's poultry workers, not community people. But it is an area of concern. Animal health affects human health. Take a look at how dairy is raised, the conditions in which they are raised, and you'll see it's unfavorable. There are species on the ground and they're walking in it, stepping in it. And there's a reason why milk has to be pasteurized. Now, soy milk is also pasteurized. When you drop it out of the container, it is already pasteurized. So I know this because I make yogurt with soy milk. I can just literally pour it in a container, add a couple probiotics, it will make delicious yogurt. And I can use that yogurt to make new, and I don't have to boil it. With milk, you have to still boil it first to make sure it's sterile. And then any comments, regular versus organic? I would say any veggies are better than no veggies. And yes, organic is better where possible, but any veggies are better. That's the short answer. And as far as the binders, so yeah, as far as it's better to avoid because they can have a negative effect on the gut, but you have to be practical also. So if we're worried about the binders and plant-based milks, we should worry more about the ingredients in animal milk. such as a breast cancer causing virus called bovine leukemia virus. It's on UCLA's website, the concern about bovine leukemia virus and breast cancer, because they found this virus in breast tumors. That's again a long story and talk by itself. Okay, so I think very good.
The Q&A, they say, what do
Oh,
you
Q&A.
think about fish in the diet?
Fish in the diet is an animal protein with harm. Now, for a lot of the studies on fish, maybe not the fish, but the things that go together with fish. Healthy
pollution.
habits. I'm sorry?
I was thinking water pollution.
A lot of pollution, yeah, mercury and other things. But just one thing, fish is animal protein. Fish has omega-3, which are favorable. However, fish also has saturated fat. Just for fun, what you can do is pop up nutritional profile of tofu and pop up nutritional profile of salmon. It's very interesting to compare. We're talking a block of tofu, 1 pound, versus the equivalent amount of salmon. And you'll see what I'm talking about. Tofu ends up more favorable. It's just no one eats that much. Actually, I do know someone who eats that much every day, 1 block, straight out of the container without cooking it, because he's kind of lazy. Yeah, yeah, yeah. Already cooked, yes. So there is, has anyone heard of this trend of local meat? That local is better? Guess what? We have local tofu in Chicago. And it's on the north side. Do you know the name? Phoenix Bean, is it?
Phoenix, yes.
Phoenix Bean.
Yes.
It is a factory. You can go on YouTube and search Chicago Phoenix Bean tofu. They will show you how they make it and the story of how that company came about. So whenever someone talks about, oh, I only eat local, you can say, you know what? Did you know there's local tofu?
We used to have Nomura, but they went out of business.
Oh, yeah. That's great. Any other comments or questions?
Have you been pressure cooking
Oh.
beans that remove a lot of the lectins?
Pressure cooking is a great idea for beans, but soaking for a long time and cooking for a long time is also valid. So anyone cook lentils before? You know, you really, if you cook in a pot, you really have to soak it. Black beans, when we're on vacation, we cook it. We don't have a pressure cooker. We just soak it really well until it sprouts a little bit. Then we cook it for a long time until it gets soft. Slow cooking is also great. Pressure cooking is fast. So the Instant Pot is a great way. Yes.
I was just gonna ask about sugar in the diet.
Okay,
because
sure.
I actually was watching the news and they had this baker on who was like the head chef at Harrods in London. And he came up with a vegan cookbook of dessert recipes.
Oh yeah, look, these are treats.
Yeah.
Sugar is a treat. Sugar is not a daily thing.
Yeah.
But what's wrong about the idea about sugar? There are so many people today who are literally afraid of an apple. They'll think they'll eat the apple and get diabetes. The idea about fruits is fruits have so many antioxidants, nutrients, and fiber that it counteracts some of the effect of the sugar. Now, there are variables. There are people with full-blown diabetes who can't eat watermelons because the sugar will shoot up. But generally speaking, the right amount of fruits in a meal with other things can be eaten without worry. Dates have to be limited by people with diabetes. So any other chat questions?
So is there a problem with consuming olive oil or avocado oil?
So again, it's the excess of it that's the problem. It's not an all or nothing thing. Many people will easily consume a 1/4 cup. Can anyone guess how many calories are in a 1/4 cup of oil? So the number. Well, let me give multiple choice. Is it 200, 500, or 1,000?
500.
500 calories in 1/4 cup, which is very easy to reach if you're making a salad or other things. So I would say keep the oil to minimum amounts as possible, or have it occasionally. But for the most part, if you learn oil-free cooking for most of your meals, you're a winner. And once in a while you go out, that's okay. You can have fried fruit every now and then, but it shouldn't be frequent. Yes.
Do you ever have cooking classes when?
Oh, cooking classes. So I can actually show you. Our nonprofit in Elgin has some videos uploaded. We have a dietitian student who is plant-based, who is giving cooking classes in Fox River Grove. So if I go to YouTube, I just want to give this plug. Every program is absolutely free. All the content is free. It's called Salient Lifestyle Center in Elgin, and it's a physical building that we have. And it is meant to educate the community in healthy eating and cooking. So I click on live. If I click on live, most of our videos are uploaded here. So these are some good ones. So there's a nonprofit called PBNM. This is Deepa, Kitchen Magic Without Heat or Sweat. Here's one, Living to 100. We did this, you know, with I believe with a psychiatrist. Oh yeah, they're going to kick us out soon. Yeah. This is one on immunity. So yes, there are cooking classes. We do live there with tasting, and there are video ones too. So any other last minute, and then we have to leave. Yeah, thank you so much, everyone.
Thank
Oh, one
you.
more. last-
I didn't write down all the information that you gave us.
Oh,
Is
yeah.
there some place to just find it, like websites you?
Sure, I will. Yeah, I will. Absolutely. I will email you. Thank you. Thank you.